to the Health Information and the Law Perspectives from the Field interview series. Today we are speaking with Patricia Montoya, Director of the New Mexico Coalition for Healthcare Quality. Welcome, Pat. Thank you so much for joining us today. Would you please tell us a little bit about your current position and how it intersects with health information exchange?
Well, thank you very much for having me. It's a pleasure to be here today and to have been a part of this group. As you mentioned, I am the director of the Aligning Forces for Quality Initiative, which is the New Mexico Coalition for Healthcare Quality that is hosted at HealthInsight New Mexico. And we have been at this work since 2009. And the focus of the Aligning Forces for Quality work is about bringing together multi-stakeholders, those who provide care, pay for care, and receive care, to really improve both the quality of care as well as the efficiency and help everyone reach the value proposition in healthcare. So as a result of that, we are really looking at what we can do to really create more efficiencies in the system, which has impacted by health information exchange. So, for instance, when we look at health information exchange, we go beyond just the technical term that many people think about when we talk about a health information exchange in a state to how and where is health information exchange needed. And so, for instance, we're doing some public reporting, and so that's about increasing transparency in healthcare on quality measures as to how both hospitals and medical groups or physicians are doing in their quality of care. But at the same time, we're also looking to reduce readmissions and also to improve care, transition care coordination. And then that is where it is so imperative that we have a functional health information exchange that allows for information to be exchanged between the different sites of care, whether it be ambulatory to a hospital if a patient's admitted, or if a patient is being discharged, being transitioned back to their provider so that there can be the appropriate follow-up, thus reducing a readmission.
Wonderful. That's incredible work. What do you see as some of the most promising efforts to reform healthcare delivery through greater use and exchange of health information as you've described?
Well, I believe that the most promising efforts are that we will at some point really reach those efficiencies and truly get to that point of not only efficiency but better quality, more patient-centered care, as well as a result of all of that, we'll be seeing hopefully reduction in healthcare costs. I do believe that if we can get all the health IT that we have going on out there in communities and states around the country truly functional and connected to each other, we will actually create what could be called a system of care. I think that's one of the challenges we have right now is that we don't truly have a system. We have many silos in which we provide care. And the inefficiencies and the costs and the loss of quality or patient-centeredness is lost as a result of that, not being able to connect all those different parts providing care to an individual.
So it sounds like one of the most significant barriers that you see to achieving these efficiencies and better quality and sharing information is the fact that while there are advances in the use of health information technology, there have been challenges in terms of connecting the systems together and connecting the providers together. And I think there's been a lot of discussion at the federal level in particular and the state level around the sense of interoperability or lack of interoperability. Could you speak to a little bit more about this barrier and ways that at the state level through your organization you're trying to address this barrier of lack of interoperability or lack of connectedness across the silos?
Sure. Well, definitely this interoperability is the major issue, not only in local communities and states, but across the country, in that even today, although there has been a major focus on health information exchanges from the federal government since 2003, 2004, we have very few fully operational statewide HIEs that have really come up and are actually successful in creating all those connections. And one of the big reasons is because of the lack of interoperability. You ask what role can the state play, and I think unfortunately at this point in time it's not something that there is an easy fix for the state at this point in time, because what has happened is that from the federal level, as there has been this push and this flow of dollars to implement electronic records and also to create HIEs and all payer claims databases and all these different systems in health technology. There has not been enough focus and effort at the top, quite frankly, in really encouraging and pushing the vendors to assure that there is this interoperability. And so, therefore, when a practice or a delivery system chooses a vendor for their health technology implementation, they, look and make sure that they meet perhaps meaningful use criteria, but that doesn't mean that they will be able to be connected to others or to their exchanges locally. So one of the things we see here in our local market is that we have 3 large hospital systems, each of which have 3 different EHRs. So, for instance, one of our large hospital systems has an Epic system, and they can work and connect within their system statewide, and they can even connect to Epic around the country. But that Epic system does not necessarily connect with, say, the Cerner system that is at another hospital, or is not providing a direct connect to the HIE. So it's one of those challenges in that, it has really begun from the very beginning where the vendors have, been out there providing products, but there has not been an effort. And probably lessons learned, if we were to go back in time, would be to say, as those federal dollars were released, there probably should have been more of an emphasis on the state at that point, being in a role of coordination to assure that those types of efforts would occur, so that there would have been a real partnership. And that wasn't necessarily the case, and so therefore we now have these disparate systems, all of which are fine systems, but not necessarily creating the linkages that were hoped for.
That's very interesting, especially the fact that there are good systems, but they're not connecting. So it sounds like in terms of the barriers to achieving interoperability, you mentioned the vendors in particular, in terms of creating systems that can't communicate with each other. Have you experienced other challenges, perhaps at the physician or hospital level, to achieving interoperability as well?
Well, yes. I mean, one of the things that we're seeing is that as all of these provider groups, whether it be physicians' offices or hospitals, they have invested a lot of their own money into their systems, and what they keep finding is that every time they turn around, in order to get themselves to a different level of being able to connect, they're having to keep adding to their system, which keeps adding to their costs. So I think what we're starting to see even more so now is more resistance on the provider side. Like saying, we thought that this was a good idea. We moved forth with implementation. We know technology is here to stay. We do believe ultimately it will help improve care efficiency and help reduce costs. But now we're finding ourselves in the position of having to keep adding additional dollars to our bottom line for this investment because of the lack of interoperability. So I do see us at some point in time sort of reaching this kind of deadlock where providers who have invested already into their systems are going to say, we've gone this far, we're not going to do any more. And so I do think it's a really critical and important time to start having more strategic discussions, not just at the federal level, but across the environment with everyone involved about where we are, what are the appropriate next steps, and what is the best roadmap to get there. Because I think if we keep operating the way we have been up until now, I think we're just going to keep hitting this one-off type of situation where we may pick up one group that gets connected, but not everybody will truly be there so that you have a fully functioning system.
So you've mentioned a couple of times the different efforts at the state level and the federal level, and I think your point about sort of assessing where we are now and strategically thinking about the path forward so we can, rather than having a continuation of sort of one-off connections, actually think about how we would achieve more ubiquitous connections. Are there particular activities that you think either the state and or the federal government could take to help move forward past this deadlock that you've described?
Well, I do think I'm not one for saying that having more meetings is always beneficial, but I do think that really thinking about a summit or a meeting or a convening around health technology connectivity in the future that would include all the stakeholder partners. And I think that's the other piece that has probably occurred, not necessarily intentionally, but sort of at point in time, that's where things have been. So when I say including all stakeholders, I think that, representatives from the states and from the Fed that are working on health technology, as well as, key stakeholder organizations, the hospital association, the medical societies, as well as perhaps some of the pioneers in this area, because I don't want to leave the thought out there that this isn't working at all and is not working anywhere. I think that there have been a few successes in some fully operational or more operational type exchanges going on, but it just hasn't been across the board, and it's been more haphazard and not systemic, if that makes sense. And I think that's the challenge we have, is that you might have, now for instance, I'm aware that in the city of Cleveland, they have created their own health information exchange, and they can do a very good job across their system there. And again, because they all went with the same vendor. And again, they have that same issue of being able to maybe go nationally with anybody that has their vendor. But if it's not their vendor, then they kind of run into some of the same issues. And so I think those are some of the areas that as far as I know, they may be being looked at a national level, but I am not aware of any work going on in that area. And that's where I do think it might be helpful to really get a clearer idea of where things are on that roadmap and where the best practices or success have been achieved, so that there is more of a goal towards which to work towards.
That makes good sense. So are there, in your experience, working with New Mexico in particular, are there any strategies that you have found working in your community that have really facilitated greater exchange of health information, understanding the barriers that we've talked about, but perhaps could be strategies that if we are able to have this discussion at a more sort of national level, strategies that you think would be useful in pushing forward greater interoperability and greater exchange of health information?
Well, I think as with anything around healthcare or this particular area of healthcare is clarity of what we're trying to achieve and why we're doing it. And, I do believe that everyone is in it to improve patient care. And everybody is talking about patient-centered care and how we create this better healthcare system. And so I think being clear on the vision of what we're trying to achieve, and then starting to look at some strategies to get there. One of the things that we find with our regional collab here at the local level is that bringing the different players to the table and laying the groundwork, having everybody on the same page is very important, as well as that also leads to building trust, which is so critical in all of this. And then realizing that everybody who is at the table comes to it with a different lens. And so there is no doubt when you talk about technology, the vendors are all there to do a good job, but their lens is very different from those who are providing care, as the direct provider, or the hospital administrator who is looking to reduce readmissions because he or she will be penalized by CMS. And so it's really keeping in mind that there are so many different lenses. So the more we can lay out that vision that I believe most folks could agree to, I think the better off we'll be. So I can tell you that right now in New Mexico, one of the things we're starting to look at and talk about is that we have been on the road to trying to build an HIE since 2004 with some positive movement and starts and stops, and some exchange occurring now, but not fully functioning and not statewide. So, for instance, when I mentioned having 3 different delivery systems in our community that have 3 different electronic health records, they are not necessarily a part of that exchange at this point in time. So we may be having input from rural hospitals, but that may not necessarily be impacting our large urban population, which is, a third to almost a little over a third of the population in the state. So as we look at the HIE, we've started talking about all payer claims database, which is another whole area of technology, and looking at quality measures as well as cost measures. So then the question is, well, can you get that out of a health information exchange? And there is a lot of non-clarity out there in that, depending on who you talk to, some people will say, well, yes, you can get what you get out of an APCD in an HIE. Well, more than likely you can't, because a lot of it has to do with the infrastructure, the technology, and how the data is being provided. So those are some of the things that need to be looked at, and so we're starting to ask that question here in New Mexico. Before building or putting in place more IT infrastructure at high cost, is there something that we have built or begun to build that we could create connections to? So it's going beyond the connection of just the electronic records, but how does an HIE interrelate or connect with an APCD or with a health insurance exchange, which many states are also building? And so that's one thing that I think states need to very much be focused on at this point in time as they're looking at building their health infrastructure.
And that's very interesting, and I think good thinking for going forward. Well, Pat, we very much appreciate your time today. This has been very helpful. Thank you.
Well, thank you.